Hello everyone, my name is Dr. Umang Agrawal. I am an infectious diseases consultant at Hinduja Hospital, Mumbai. Now, we have been hearing outbreaks of monkeypox all across the world. Fortunately, no Indian case has been reported. And however, we need to be vigilant about this disease. And for this particular reason, I'm going to share a few points about this disease, what are the symptoms caused, and how you can prevent it. Monkeypox is a viral illness which is very similar to smallpox, which we used to have before, which has now been eradicated. The virus which causes monkeypox is very similar to the one which we used to call smallpox. In the smallpox vaccination era, that particular vaccine used to provide us with protection against monkeypox as well. However, ever since smallpox has been eradicated and the smallpox vaccination has died down as well, the incidence of monkeypox is increasing. Monkeypox is predominantly found in Central and Western Africa. Presently, there has been an outbreak of this particular disease in multiple parts over the world, including United States, United Kingdom, Australia, Canada, Spain, and Portugal. The conventional teaching was that monkeypox is transmitted by the bite or by petting of certain rodents which are found in Central and Western Africa. There was an outbreak in the United States in 2003 wherein they actually traced the source of monkeypox to be pet prairie dogs. And when they finally investigated, they found that these particular dogs were actually kept in close association with rodents that were imported from Central Africa. Ever since then, the import of these kind of animals has been banned by the CDC. More recently, there have been definite outbreaks in various parts of the world. There has been some talk about this particular disease might be transmitted by sexual transmission. However, confirmed reports are yet to come in. Now realize that you will suspect monkeypox in a patient who has recently traveled to Central and Western Africa or who has been in contact with a known patient who has had monkeypox. The general signs and symptoms begin around 6 to 13 days after contact with the infected animal or the infected person, and it begins with fever, body ache, chills, asthenia, that is generalized weakness. Eventually, a rash appears over the body, starting from the face, involving the trunk, the arms, the palms, and the soles. These particular rash eventually coalesce and they form blisters or vesicles. The entire spectrum of the disease lasts for a period of around 2 to 3 weeks, and thereafter it subsides spontaneously. In addition to the rash and the blisters or the vesicles that you see, you will also find some swellings over your neck, over your groins, that is known as lymphadenopathy, that is enlargement of the lymph nodes. This particular disease looks very similar to chickenpox or smallpox. However, appearance of this particular lymph node is quite characteristic for monkeypox. Please understand that majority of the cases of monkeypox are self-limited, that is, they will be managed conservatively. There is no specific drug that you really require, and around 90% of the times you will be absolutely fine by yourself. Certain patients might require admission because of dehydration or other such problems, which needs to be managed conservatively. Presently, there is no FDA approved drug for the treatment of this disease. However, an old antiviral has been tested in animal models for this particular disease, which seems to be promising, and in severe cases, it might be used. So there are 2 or 3 steps that you need to do. First step, immediately isolate yourself. Make sure that your loved ones are not near you. Second thing is get in touch with your doctor so that you can explain the symptoms to him. That is all that needs to be done. In case you have fever, you will take paracetamol. In case you are feeling thirsty or dehydrated, you will take water. In case you feel itching, then you will take anti-itching medications. There is no need to panic. Please seek medical help immediately and make sure that you have isolated yourselves from your other family members.